The Bureau's Income, Poverty, and Health Insurance report released yesterday indicates that the official rate last year was 13%, with a total of 36 million people living in poverty. Additionally, it reports that blacks, despite showing no increase from last year's levels, comprise 24% of those living in poverty, while Hispanics followed at 23%, Asians at 12%, and whites at 8%. The Alliance for Children's Rights provides free legal services, information, and social services to children living in poverty and foster care. Social worker Barbara Fisher analyzes deficiencies to LA's young.
So many of the problems that we see and the issues that we deal with can be directly traced to and are exacerbated by poverty. And it's hard to believe that in LA there's kids who come to school and they haven't eaten breakfast, but there are. And there's countless studies that show that kids who live in poverty do poor in school, have poor health, and it's not just some of these cuts in programs that have that are, I believe, are one of the causes of this rise in poverty. The closures of health clinics, the closures of mental health services for kids and families. So many of these cuts are to deal with budget problems, and they're not just penny wise and pound foolish, they're penny foolish and pound foolish. I mean, there's a direct link between children living in poverty and growing up to be adults living in poverty and needing social services and not being able to find jobs where they can support themselves and not having health insurance. And we're going to see an increase of kids in juvenile hall instead of in school, and an increase in children removed from their homes and in foster care because families can't care for kids. It's going to be more of what we already know exists, but on a much larger scale. It's frightening and it's horrifying that this exists in Los Angeles, that you can take a however many mile drive it is from, Beverly Hills to South LA or to downtown LA and see the contrast in the lives of these kids. And, what's frustrating from a social work and advocacy perspective is that it isn't like, oh my goodness, what do we do? Nobody knows. There are programs that work. There's programs that have proven to work, whether it's in preventing teen pregnancy or improving the outcome for kids born to teen parents and breaking that cycle, or whether it's programs that help kids who enter school not really ready without having had the preschool experience that helps them be ready, and there's intervention programs. There are programs that work, and they do cost money, but they are so, if you're looking at it purely from an economic perspective, which we shouldn't, but if you did, they're so cost-effective in the long run.
More information about poverty, income, and health in Los Angeles can be obtained from www.census.gov. For the KPFK News, I'm Sister Charlene Muhammad.